On this part, I want to show you how to turn the ozone machine on, or how I turn it on or off. Ozone, as a side note, is really good for disinfecting the tooth. It kills any bacteria that's anaerobic by giving it a high dose of oxygen. It'll kill any bacteria in the tubules, and it also helps teeth become less sensitive. So if there's a really deep filling, if there's any cervical abfractions that are deep and sensitive, root sensitivity, I'm always going to go ahead and use ozone. Each of the ozonators are in every single room, and each of them are operated relatively the same way. So the ozone machine is over here. There's a little wand that's attached in each of the treatment rooms. So these little blue caps that go on and snap on. And each of these blue caps are good for cupping the tooth. So I can put it on top of the tooth, and then I'll look at the clock and make sure I'm holding on for at least 1 minute, cupping the tooth with the ozone on. To turn the ozone machine on, the on button is here, but the ozone needs oxygen to run through it to be converted to ozone itself. So the oxygen tanks are in each room. In each of the treatment rooms, we have the big tank. On several of the other rooms, we have the tanks in the cart. There's a key that's on top on the smaller tanks that says on, and you turn it counterclockwise. So what you're going to do is I'm going to turn this on, which is counterclockwise to the right. I'm going to see that the tank is now pressurized. And usually I only need to turn it to 1/16 on the dial. Then what I'm going to do is just hit the on button here. The green button shows and you can hear, and then you can smell that the ozone's actually coming out of the ozone handpiece. Now that I'm done using the ozone, I hit the buttons off. I turn the regulator dial to off, and I turn the dial back clockwise, and I can feel that the tank is locked. If we don't turn the valve off and the tank stays pressurized, it'll actually leak oxygen throughout the night, and even though it makes no sound or gives any indication, the tanks will then be drained for the next procedure or the next day. Now, as part of the ozone setup, there are also other things that I may use in the room. I may inject ozone if I'm doing surgery or using it for an ozone-treated root canal. And I can use these little syringes, I'll show you where they're kept in central, to fill them up with the ozone gas. And they can attach to the little port that's here, and you can screw them on. And I can fill them up with gas in the room and use that to inject. I also keep a lot of the needles for injection in the room, or I'll grab them before the patient's brought in. I might also use ozone, which works great for cold sores. The ozone will actually stop the vesicular outbreak. If someone has an active cold sore that's already blistered, it'll dry it out and help it heal a lot faster. You could use the ozone cup on it, but I prefer to use the wanded cup. It's a glass cup. It's kept in the ozone drawer. And you can put it over the area for a couple minutes. If someone had a sty on their eye, they could keep their eye closed and put this over it. I love it for all sorts of things. And this has a male and female part that connects into the handpiece portion here that's pretty easy to detach. So you can also use this easily in the room by unscrewing the handpiece and then screwing this piece into the connector here like this. Then all you have to do is just hit the on button with the gas on, and then the ozone's going to come out. And Dr. Vane will instruct you on how long to use the ozone. But that's what we'll use. This is the cold sore cup. This is the cup for all restorative work and any sensitivity. And these syringes I use for injecting the ozone or irrigating the ozone into the canals. You can bring these in, or Dr. Vane will grab them and bring them into the room.